Hello, I am Dr. William Song from Omni Aesthetics, and in this segment, we will be talking about the difference between liposuction performed under local anesthesia versus liposuction performed with general anesthesia. And we'll also go over some of the things that you can expect when you decide to have your liposuction with us at Omni Aesthetics. So let's begin with talking about the difference between general anesthesia and local anesthesia. So general anesthesia means that you're going to be put under, you're going to be unconscious and paralyzed. So a breathing tube will be placed to help you breathe, since you won't even be able to breathe on your own. With local anesthesia, we use a numbing fluid to numb the area that we will be working on, but you're fully awake or under just very light sedation, and you'll be able to talk to us and participate with the procedure. And sometimes you might feel a little discomfort during the procedure because you will be aware of what's going on. So why would you do local anesthesia versus general anesthesia? Well, the biggest reason is because local anesthesia is going to be much safer. So the thought of just going to sleep and then waking up when it's done can be appealing, but if you consider the risk of general anesthesia, especially for a cosmetic elective procedure like liposuction, it really doesn't make sense to go under if you don't have to. With general anesthesia, you have higher risk of complications, including not waking up from the anesthesia. And because you're unconscious, there's also a higher risk of accidents happening, such as perforating an organ, because you won't be able to feel if the doctor is going to an area that's not numbed. And whereas if you're under local anesthesia, once you go outside of the area that's numbed, you can feel it, so you'll be able to participate and say, hey, that hurts, and that's going to make a big difference in avoiding any type of injuries. The other thing that can happen with general anesthesia is because you're unconscious, you're not going to be moving at all, and you're paralyzed. So you're going to have to be physically moved or have a alternating compression device to prevent the blood from pooling in your veins, which can lead to a blood clot. And if you get a blood clot, it could travel to your lung and cause a pulmonary embolism, which could be fatal. The risk of that kind of thing happening is very, very minimal with local anesthesia, because you are going to be awake and you'll be able to shift your weight around so you don't get blood clots, unless you had a pre-existing blood disorder that predisposes you to getting blood clots. You really don't have to worry about blood clots if you're getting local anesthesia. The other benefits of local anesthesia is that the recovery is going to be much faster. You'll actually be able to stand up and walk right out of the procedure, whereas with general anesthesia, there's a period of recovery where you have to wake up, and then you're going to be groggy for a while, and you're going to have to recover from the anesthesia itself in addition to recovering from the procedure. And finally, the advantage of doing local anesthesia is you are actually going to get better results. And the reason for that is because you know how if you're lying down, everything looks good, right? Because all the weight is shifted. But when you stand up, gravity pulls everything down, and it looks very different. Your body looks different when you're standing versus when you're lying down. So after we perform a liposuction procedure under local anesthesia, we'll stand you up and make sure everything looks good, both lying and standing. And if it doesn't, if it looks like when you stand up, the fat kind of shifts and it looks like you need a little more, little touch up in certain areas, we can just have you lie back down and just take care of the issue right then and there. Whereas with general anesthesia, if you find that there needs to be a touch-up that needs to be done, we generally can't put you back under anesthesia. You probably have to wait until you recover and have a second procedure to correct those things. So that's how we get much better results with local anesthesia. You can also help by moving. We can ask you to turn over, turn around, that kind of stuff, which makes it much easier to get to certain areas in your body when we're doing the anesthesia under local. So those are the differences between local and general. So are there any risks of local anesthesia? So as I mentioned, the risk is much less, but there are certain risks even under local anesthesia. There's going to be risks with any type of procedure. So the biggest risk of having liposuction under local anesthesia is lidocaine toxicity. Lidocaine is the numbing solution that we use to numb the area that we are going to work on. But so if you do develop lidocaine toxicity, some of the symptoms are you may have some tingling or numbness around your mouth. You may feel lethargic. You may have some mental status changes, you get confused. And in severe cases, you can even develop seizures. And although that is something that we need to be aware of, is as long as we stay under the safety limits of lidocaine, it's very unlikely to happen. And the way we determine how much lidocaine we can safely use in one procedure is going to be based on your weight and how you tolerate the anesthesia. If we find that you're very sensitive to pain and we have to use more local anesthesia, then we may have to break up your procedure. We may be able to do one section, and if you're very uncomfortable, we'll use more anesthesia, but we may have to save another area for another day, which is okay because unlike general anesthesia, there's really no additional risk to doing the procedure on a separate day. In fact, it's safer to do it that way because you won't get too much lidocaine in one session. And then there are other risks that are common to any type of procedure, such as infection, bleeding, bruising. And we like to give you a antibiotic as a preventive for infection. So we'll have you take an antibiotic the morning before, the morning of, and then for a few days after the treatment, just as a preventive. And the other risks, like bleeding, is possible, but it's very minimal. There's actually very little blood loss with liposuction under local anesthesia. You will get some bruising, and it may be a small amount of bruising, or it could be significant. You can get a nice blue or purple discoloration to the area that we worked on. And to minimize the risk of bruising, you want to stop any blood thinners that you're taking unless it's medically necessary. So things like aspirin, ibuprofen, and herbal products like ginkgo biloba, turmeric, vitamins like vitamin E, they tend to thin your blood. So unless you have a medical reason for taking it, you may want to stop those at least a few days before the procedure. Other risks of liposuction are things like seromas and hematomas, and those are basically collection of serum, of fluid or blood in little pockets that can form. And usually they're not a problem. They can go away on their own. Sometimes we need to put a needle in there and drain it. But not a huge deal, but those are things that can happen. Other things that you need to be aware of is that allergic reactions to the medications and antibiotics that we use are possible. So if you do have any allergies that you know of, please let us know so that we can look for alternative medications that we can give you. If you're allergic to latex, please let us know of that also, although we don't use latex gloves anymore, but it's always good to know if you have an allergy. Finally, other risks are just simply not getting the results that you were hoping for. You may end up not getting as much fat sucked out of you as you hoped, or you may have some lumpiness, or you may have loose skin. So usually we can kind of predict by looking at the quality of your skin whether you're a good candidate or not. So it's important for us to examine you before you come for your procedure. Although if you're doing if you live far away and you're doing the consultation through Zoom, we can still do it. But if it's possible, we'd like to examine you in person. And once you do decide that you are going to have your procedure with us, there's some steps that we will take. And the first thing we will do is we are going to send you some consent forms. Consent forms will list the possible complications and things that you can expect, many of which we covered here, but it'll be in a little more detail in your consent forms. So we do ask you to read over the consent forms. Don't just glance at it and sign everything, because we want you to know what to expect. And if anything on the consent forms doesn't sound right to you, please ask us, and we'll tell you, because some of the things listed on there can sound pretty scary, and we can just go over it and tell you what the real risks are so that you can make an informed decision. And we're going to give you an opportunity to answer any last-minute questions, but you can always call us too beforehand. It's always better to have your questions answered before you actually come in, because if you don't like the answer to a question you have at the last minute, we don't want to have to cancel your surgery on the while you're about to get the procedure. So when you're here, we are going to take your vital signs, make sure your blood pressure and pulse and everything like that is good. We're going to go over your blood work, and we're going to weigh you. And we're going to take some pictures because we need to document your before pictures, and this will help us to monitor your progress. And then you can also, it's a good way for you to go back and see how much better you look after it's all done. If you need pain medications, we will prescribe it for you so that you can pick it up before you come for your procedure. And you bring it with you, and then we will have you take it just before the procedure. Most people actually don't need prescription pain medications or anxiety medications. Most people are okay with Tylenol. But if you do have a tendency to be very anxious or sensitive to pain, that's an option. We're not going to give you enough to knock you out, but we can give you enough to just take the edge off. For the procedure, you can leave your underwear and bra on most of the times. And depending on the area of your body that we're working on, sometimes we will need to have you remove your underwear and your bra. And we're going to mark your skin. We're going to make markings on your skin to mark the areas that we are going to be working on. And then your skin will be cleaned with a surgical cleanser. And we also ask that you purchase HibaCleanse, which you can get on Amazon or at your local pharmacy. That's a surgical cleanser, and you can take a shower with that the night before or the morning of the procedure. And once all that is done, we are going to mark the entry sites, and we are going to numb it with a very tiny needle. And then once the entry sites are numb, we'll make little holes, about 1/2 centimeter, maximum 2 centimeters. And those holes will allow us to go in with a cannula to put the numbing fluid in. And we're going to use the same entry sites to take the fat out. And typically we'll make those entry sites in areas that are not visible, like below the bikini line, in the belly button, or under your breasts, or in your armpits. But sometimes we do have to make the entry sites in an area that is visible. But again, the holes are small, and usually once they heal, you can't really see them, or we can use a laser to kind of clean up the little scars from the entry sites. But that will happen months later. Once the entry sites are made, we'll infuse the area that we're working on with the numbing fluid. So that's basically a bag of IV fluid with lidocaine. We also use sodium bicarbonate, which is a buffer, so it doesn't burn when it goes in. And we also use some epinephrine, which constricts the blood vessels to minimize the bleeding and bruising. And once the whole area is infused with the numbing fluid, we'll use a gentle vibration to spread the numbing fluid and also to break up the fat before we start removing it. And once the area is numb and the fat is kind of prepped, we can suck out the fat, and we will use a device called microair. This is a power-assisted liposuction. It basically vibrates while it's sucking, so we can use that to actually sculpt your body and give you a smooth finish. So again, the area that we're working on is going to be numb, but you'll feel some pinching and tugging and pressure as we're working because you are awake. And we can make it more comfortable for you. If you didn't take any oral medications, we can give you Pronox, which is a mixture of oxygen and laughing gas. And this is a nice way to relieve your anxiety, because the nitrous oxide or laughing gas leaves your system within 5 minutes. So you just take it by just inhaling as you need it, and you control how much you take. It's not going to knock you out. It's just going to make just kind of make it easier for you. Okay, and after we suck the fat out, we will use. You have the option of getting skin tightening from internally with a device called Renuvion, and this is using radio frequency and helium gas to stimulate that skin from underneath to tighten. And if we're taking out large amounts of fat, this is highly recommended to minimize the loose skin that can be left after the procedure. And this also allows us to take more fat than we normally would be able to, because if we tighten the skin a bit, we have less loose skin left, so we can take out a little more fat. And sometimes if you've had previous procedures, whether non-invasive or previous liposuction, such as smart lipo, or if you've had cool sculpting in the past, the fat can be fibrous and difficult to remove. So we'll use a device called Vaser, which is an ultrasonic device that can break up the fibrous tissue and break up the fat and allow us to take that fat out. And incidentally, if you had CoolSculpting and developed a condition called PAH, or paradoxical adipose hyperplasia, that's when the fat gets bigger after you have a CoolSculpting treatment. The Vaser liposuction is the only way that you can remove that fat because it's very fibrous, and that's something that we do here. Not many practices do that, but that's something that we have done quite a few of, and that's something that we can do. So after we remove the fat, we can either discard the fat, send it to medical waste, or we can reuse your own fat. And this is a great opportunity to get a fat transfer. Fat transfers to the face are one of our specialties. People come from all over the country, all over the world actually, to get this done by us. We've been doing facial fat transfers for over 10 years, and we've kind of perfected it. So we get some really nice results. And I love doing fat transfers to the face because if you're someone who gets fillers regularly, it's just a no-brainer to get fat because the fat's going to last you for a long time, and we can do much more volume with the fat, whereas you're typically getting syringes of filler that are like 1 cc syringes. When we do a fat transfer, we typically put like 10 to 30 cc's of fat, and so we can give you a nice volumization. And also, the fat has regenerative properties, so your skin's going to improve, and you're actually going to look not only more volumized, but the skin's actually going to be younger, more supple and elastic skin because of the stem cells that are in the fat. So we can definitely take advantage of that. We can put the fat in your breasts. We can put the fat in your butt. We can put it in your hands. Whatever you can think of, we can do a lot of things with the fat. So if you're considering any kind of procedure that involves a fat transfer, do let us know so that we don't throw away your fat. And then finally, we will do an acoustic wave treatment to the area that we worked on. And the acoustic wave is a shockwave device that helps us to smooth out the fat to give you a nice smooth finish. It also helps with the drainage, and also releases stem cells, so it allows you to heal faster. The acoustic wave kind of does the same thing that the lymphatic massage will do. So although we recommend lymphatic massage after the procedure, if we do the acoustic wave, you don't absolutely have to get the lymphatic massage. You'll still get a great result. We're going to put some dressings over the opening because they're going to continue to drain for 24 to 48 hours, and sometimes there can be quite a bit of fluid that comes out. So we like to put a maxi pad over the openings to capture all the seepage of fluid that comes out, and then after 24 hours, you can put just regular dressing, and then eventually just put a Band-Aid over it, and the little holes should close up within a week. And we don't put drains in you. We don't need to leave any drains in you. We just let it. We'll suck out most of the fluid with the suction, and then we'll just leave the little holes open in your under your waistline to just let it drain. Once the procedure is over, you'll be able to just get up and start walking right away. And that's another advantage of local anesthesia versus general anesthesia. So just to go over a little bit in detail about your recovery, as we mentioned, the fluid seepage will continue for 24 to 48 hours. So do expect the first night to be a little bit messy. Put some old beach towels on your bed so that you don't get your mattress dirty, or you may even want to put some plastic over the mattress and then put a clean sheet on top of that. You will have some bruising. Sometimes the bruising can be significant, and gravity is going to pull that bruise down. Bruising is basically bleeding under the skin. So that blood is going to get pulled down by gravity. So don't be surprised if, even though we worked on your belly, the bruise starts moving down your legs into your thighs. And it can also kind of pull up in your genital area. So women, if your vulva turns purple, don't be alarmed. And men, your scrotum may turn purple and swell up, and it could be kind of shocking to see, but that's nothing to get alarmed about. That's just the blood just kind of pooling down there, and that's gonna go away. So you don't have to worry that anything crazy is going on. You will be tender. It's going to be sore. And the soreness will be the worst the first night. And then every day it's going to get better. But do expect to be pretty sore for anywhere between 1 to 3 weeks. So because of the tenderness, you probably don't want to start working out at the gym the next day, although there's nothing that would come apart or anything like that if you worked out. It's just that you may be too uncomfortable to go back to your regular workouts, probably for about a week. You will have swelling, and that's why we want you to wear the garments. And the swelling is gonna be much better after the first 2 weeks, and will kind of last for about 4 weeks or so, or sometimes you'll have a little residual swelling for months. The final results could take 6 months. That's why we want you to wear the garment. The compression garment, you're going to wear it 24 hours a day for the first 2 weeks, except when you're washing it, give you a little break. But after 2 weeks, you can switch to 12 hours a day. You can do 12 hours during the day or 12 hours at night, whichever works better for you and your schedule. And then after 6 weeks, you can stop wearing the garment if it really bothers you, but we recommend that you wear the garment as long as you can for up to 6 months, because the results are going to be much better, because there's going to be molding that occurs. So the garment will actually help mold and shape your body as you're healing. And we mentioned lymphatic massage. If you decide to get lymphatic massage, typically you get about 10 sessions, but because we do the acoustic wave, you don't necessarily need to get all 10 sessions, or you can even skip it. It's not absolutely necessary, but you will get heal faster and possibly get better results if you get the lymphatic massage. And we can tell you where you can get lymphatic massage locally. And the final results, it's going to take about 6 months to really see the final results. After a couple weeks, you are going to see a significant improvement, and it's going to improve and get better every day. And it's kind of fun to watch, because you think you're done and you see more and more improvement, and that improvement can typically lasts about 6 months, but even up to a year, people see more and more improvement occur. So you have to be patient if you're not seeing your desired results right away, because you just may not have healed all the way yet. So